Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pulses paradoxus. So pulses paradoxus, let's look at the physiological causes. So in terms of the physiological causes. So here in terms of physiological causes, there is presence of obesity. So physiological causes, there is obesity as well as presence of the pregnancy. Next is we look at the cardiovascular diseases. Cardiovascular disease causes. So what are the cardiovascular causes? It includes the cardiac tamponade. So in cardiovascular cause, there is cardiac. So there is cardiac tamponade. And the cardiac tamponade is nothing but MC. MC stands for the most common causes cardiac tamponade. Next is the presence of there is massive what? There is massive pulmonary effusion. So in terms of next cardiac tamponade, and then there is also constrictive. Before that, let's look at constrictive. So there's constrictive pericarditis. So constrictive pericarditis is present in 1/3 cases. So the most common is the cardiac tamponade. Next is the third one. The third one, it includes a massive pulmonary embolism. So third one, it includes a massive pulmonary embolism. And then there is a severe CCF. There is presence of severe CCF. Thanks to cardiac failure, and then the hypovolemic shock is also present. Hypovolemic shock is also a part of this. Then we move on to the respiratory causes. So what are present in the respiratory cause? So here in terms of the respiratory cause, this includes a severe obstructive pulmonary disease. So the severe obstructive pulmonary disease. So there's presence of severe obstructive pulmonary disease, then there's acute severe asthma, presence of acute, and there is acute severe asthma as well as severe emphysema. There is presence of severe emphysema. So the severe obstructive pulmonary disease, the severe acute severe asthma as well as severe emphysema. Next is the presence of the tension pneumothorax. So there is also presence of the tension pneumothorax. To learn and grow daily like this, please do subscribe.